Thank you, Kevin, for that nice introduction, and thanks to all of you for staying so late. I know that I'm standing between you and a flight, or you and probably dinner, or maybe even your Christmas shopping, so I'll try to be brief. Earlier this week, before the meeting started, the Interagency Supply Group had a chance to meet, and I wanted to just tell you a little bit about what the Interagency, did I do it right? What the Interagency Supply Group actually is, and why we met, and where these meetings of the interagency, the mysterious Interagency Supply Group, will go. It's basically a group of policy organizations, UN organizations, and funding governments and agencies. It's not a political group, it's a group of high-level technical people. And one of the reasons that we started talking was that when we look at supply chain, we realized that we could be a little bit more strategic with the investments in supply chain from the international community, national governments, and the like, if we spend a little bit more time talking to each other and trying to coordinate. One of the important things that's come up for us is that when you look at where medicine demand is going to be, when you look at the rate of population growth and the demand that's going to place on supply chain systems, I think it's pretty clear that the current models are going to be strained to a point where we probably are going to need to do some things differently. So the Interagency Supply Group is really just it's an informally constructed group, but it's identified some key areas of work that are important. I won't go through every single one of these, but I do want to talk a little bit about what this is all about. This is really all about trying to set the stage for the future in terms of how we invest, what we think is important, but also to do things in a way that maybe is a little bit different in some areas. And just to give you a couple of examples, one of the things that we've been talking a lot about is assessments and how we go about strengthening supply chain systems. We don't necessarily all do assessments in the same way, and we don't necessarily ever share that information with each other. So there's some things that we could be doing to actually support more sharing and maybe even a common approach. Some of the other areas that we've been talking about are how is it that we've been talking a lot about data. I've heard more discussion around data in these past 2 or 3 days than I've heard in a long time, but what data are we collecting, and is it the right data, and is it actually telling us what we need to know as we look forward in the future? We can talk at global levels, and that's nice, but it's also pretty important that we actually talk to our counterparts in countries and to make sure that it's not a coordinating voice sitting in Geneva or Washington or a place where a lot of us do our business, but that we're actually supporting countries who have plans to do things in coordination and to harmonize. It's not integration for the point of integration. It's really about how can these things be coordinated so that they're more useful. Just wanted to give you a little bit of an idea. I mentioned that there were 7 areas that the Interagency Supply Group had identified as being important. They're not necessarily there to shape the future per se or a definitive list. It's really about starting that discussion and starting that dialogue toward what the future looks like. So there's 3 key areas. One is really around improving operational efficiencies. And we've had a lot of discussions with people who are with agencies who are actually also part of people that deliver, talking a bit about what they're doing to coordinate on training that you've heard a lot about today, and also talking about some of the other important areas of human resource. Looking at strengthening supply chain systems, some of our approaches may need to be expanded in the future, and what does that actually look like? And when we talk about the enabling environment, I think that's an important one both in HR and also in just, I think some of the conversations that we've been having about where does HR supply chain fit in an enabled environment, and where are policies and where are the other pieces that should be in place in order for the future to go forward with the support that it needs. I wanted to just give you a couple of examples. These came up in our conversations on Monday, talking a little bit about improved operational efficiencies. I think that you've heard a lot from colleagues from PTD about coordination of training and the collaboration and the collaborative environment that people that deliver has created. But one of the things that I think is really important to include in that conversation, I've heard a lot about professionalizing the supply chain, and that this is a recognized profession. And we have ways of assessing whether or not we think the agencies that we work with have the right people, the right capacities, and the right training. But another conversation that we could be having is, what is the leadership environment? How do we actually assess leadership in supply chain? It's not necessarily it's not about doing an audit or a performance evaluation of the chiefs of agencies or the CEOs, but really about asking the question, if we go to this investment, if we take this investment to really create professionalization and build capacity around human resources, where does the leadership sit? Where are they? Are they actually enabled by their government to do what they need to do? Do they actually have a clear mandate? We talk about stockouts all the time, but what is actually their responsibility? 100% of need? 50%? Just spend the budget that they have? We hear a lot about, we ask agencies, what are your targets for next year? And they'll typically say something like, this year plus 10%. That's a commercial goal. That's not necessarily a public health goal. So how do we change that definition, and how do we enable leadership to support these efforts? In order to professionalize supply chain, we have to really do something about that leadership environment. Where are the leaders? How do they interact within the government? And are they actually empowered to do what they need to do? I talked a little bit about coordination of assessments. I think, how many people have done an assessment of a supply chain in the last 3 months? Keep your hands up. 6 months? 1 year? In your life? Okay, everybody hands up. You've all done at least one. But I think the point is, one of the things that we know is that we all assess things from a different standpoint and a different perspective. There is no one size fits all for assessments, but one of the things that we know doesn't fit very well is that when we go to an agency and we find a department that says assessment coordinator on the door, we know that some of what we're doing is probably a little bit overdone. There must be a better way to share information that we're getting from assessments. Maybe some common approaches, maybe some ways to actually make that information more available and to make it more useful. We understand clearly that an assessment might have some confidential information in it. It might actually talk about people and their ability to perform or not perform. That's sensitive. That's not going to be put up on the internet. But probably certain other elements could be put up on the internet, could be shared with other agencies, and certainly could be used in a more systematic way to help guide investments. And I just want to make sure when I say investment that I'm really clear that I'm not necessarily just talking about the investments that have been made by international agencies over the last 25 years, but to really also acknowledge that those who invest also include country governments. They invest tremendous amounts in infrastructure, in training, and in personnel. And we've talked a lot about 3PLs and outsourcing. That's also an investment. Private actors who contribute to supply chains and public health also make investments. So when we look at that, when we look at how we use this information to support investment, there's doors that we could be opening that we haven't been in the past. The last piece I just want to talk a little bit about, there's a couple of, I want to give 2 examples. One is about a knowledge initiative that my colleague Eric Millard from the World Bank is working on, and another one that has to do with indicators. We've talked a lot about indicators. I'll speak a little bit to Eric's work, but I'm going to let him fill in or respond to questions because this is really an activity that he's taken on. The World Bank has embarked on a knowledge initiative to really understand what does make a supply chain efficient. What models are out there? What do we know about them? And what are the indicators that we're using to say whether they're efficient and whether they actually, are we actually even monitoring the right things about them? If we think that one indicator is an indicator of performance in a certain area, we might actually be wrong. We actually did an assessment in a few countries at WHO where we looked at something being registered by the National Regulatory Authority, something being included on the essential medicines list, and the assumption was that those would be indications that you would expect to find that in the procurement system. And by and large, we found that wasn't actually the case. So looking at what is it that we're expecting those indicators to show us, and is it actually true? I'll let Eric answer questions about that, but I know from our discussions on Monday that the data gathering around that is ongoing. More data is needed, and but I think this analysis is going to be a huge contribution to policy development later. Thinking a little bit about indicators. We did a little bit of an inventory of all of the indicators that we like to monitor. Now this is a summary of what we found. There were about 19, actually there's more than 19, but 19 that we were able to count up in a 2-week period. So we started counting up how many indicators are out there about availability. Most of them were stockouts, and most of them were defined differently. So we say how many stockouts do you have, but what's stockout? Is it at the central level? Is it at the district level? Is it in the nurse's drawer? What does it actually mean, and what does it actually tell us? It's not really a diagnostic, it's an output. But we found that there were 19 different definitions. There were at least 7 different programs promoting those different definitions, And we weren't able to get responses, or we weren't able to actually reach out to national governments to see if they were actually using those indicators, but that's another step we can take. Same thing with quality. Whole lot of information about stockouts, not a whole lot of information about quality. Does it really matter if we have good stocks of things that we can't use? Maybe not. Efficiency, things like wastage, again, some pretty healthy indicators, but many, many different definitions. So you can see what this landscape looks like. And one of the things we're embarking on is an attempt to actually try to normalize some of those indicators. It doesn't stop people from collecting data on other areas. But if there's some way that we can streamline that, if there's some way we can let those poor people in the Department of the Assessment Coordination Division, or the person with the title Assessment Coordinator, if they could maybe go home for their birthday, for their children's birthdays every once in a while, and not be constantly managing different data sets, this might be actually helpful for us. So in closing, when we think about the way we do things, in some cases we are working at cross purposes if we haven't coordinated, and surely we can do better than that. Thanks very much, and have a fantastic time in Copenhagen if you're staying, or a safe trip home.